Good Sunday morning, everybody. This is Eric Wilson, Mayor of Forsyth, and I'm so glad to be back with you on the radio here this first Sunday of the month of January 2021. Who would have thought it? We're already in 2021. 2020 is now really hindsight for us, I guess, as somebody said on Facebook the other day. Dangerous repeating things you read on Facebook sometimes. But I'm so glad today to have a special guest with me. On a serious note, Dr. Jeremy Goodwin. He's a local physician that many of you know and trust, and he's also the chairman of the Monroe County Board of Health, and I serve on the Board of Health with him and respect all that he does for the community in that role. And he's got a new role coming up too, so it's January, and he's being sworn in as a new Board of Education member. So I don't know when he sleeps, but thank you, Dr. Goodwin, for being with us this morning.
Good morning, Mayor Wilson. Thanks for having me.
So today, we've talked on several of these broadcasts. I've talked to you about doing the right thing, of protecting ourselves, protecting our community with regards to COVID-19. It seems like a nightmare that we've lived for the last several months. Dr. Goodwin has been in the trenches on this fight. He is in the hospital every day seeing patients with it. And Dr. Goodwin, I just thought it was very timely. We've got a vaccine now. We're finally seeing some light at the end of the tunnel. But I just wanted to have you on today to talk to our listeners about some of the things that they could still be doing. And then we want to talk about the vaccine and kind of some of the things that are going on with the vaccine locally in our community.
Okay, I appreciate you having me. First off, COVID-19 is the worst it's been since, this started back in March, April for us. We had a bump in the summer that was fairly bad, but I can tell you that the caseload that we're seeing now, the hospitalizations that we're seeing now are on a higher order. The other concern I'd like to share with everybody is that, the hospital systems are full and overloaded already, and that's one of the scenarios we were hoping to avoid, but that's where we are, and that's why it's so important going forward that we do everything that we possibly can to diminish the effects of this pandemic. And so, like Mayor Wilson was talking about, the easy things that we've been talking about all along, which is wear your mask whenever you're outside around other people, social distance whenever you possibly can, avoid large gatherings of people, even avoid large gatherings of family at this point in time, because we are seeing such community spread that first came out of Thanksgiving, and I'm afraid that we're going to see even more that's coming out of all the gatherings that occurred over Christmas. So we know that at this point in time, the surge that we're seeing is likely due to Thanksgiving. So mask wearing, social distancing, but I think just so important, even though we love our families, we want to get together, we want to do things with them, we want to see our friends. We're at the stage in this thing where we really need to be careful to protect ourselves and to protect our family and our other loved ones and friends. The vaccine is very exciting. We have two of them that are available now. You have the Pfizer vaccine and the Moderna vaccine. Both of them have been pushed out and approved by the FDA. I think that they went through the appropriate studies. I think they made it through phase 3 trials doing very well. They had great efficacy, which is very exciting. To see a vaccine with 90 to 94% efficacy is something that is very exciting to see. And then the other thing is
how does that compare for reference to the seasonal flu vaccine?
Great. So usually your flu vaccine is about 50 to 60% effective.
So wow, this is much, much more effective than the seasonal flu vaccine.
Much more. The data that they're seeing out of these two vaccines are pretty incredible. And then because we know they made it through phase 3 trials, we also know they're safe. So those phase 3 trials, which are so important, included tens of thousands of participants. Okay, so we know that this has been given to a lot of people, and we know that the safety profile was very good. So you have good efficacy, very low risk, very few side effects, and this is what eventually is going to get us out of this pandemic.
And I think, when I watch the news or read accounts on it, it tells us that we're going to have 70 or 75% of the population get vaccinated in order to reach immunity that's sufficient to
stop the spread.
To stop the spread, right.
That's right.
So before we delve even deeper into the vaccine talk, you hit on something earlier that I wanted to come back to, and that is the overwhelming of the hospitals and the healthcare system. So exactly what does that mean? Tell the listeners, what does that mean when the hospitals are overwhelmed?
So you want the scary stuff? So what that means is that at the current time, all the hospitals are basically full. And there's no ability to transfer patients who get really sick to any other hospitals. And today I was told that all the other states have basically said they're not going to take any Georgia patients anymore, because there was a short period of time where they were able to transfer patients to Florida, Alabama, South Carolina even, but my suspicion is that their caseloads have gotten so high that they're not going to be taking any transfers. So when you say the hospitals are overloaded, you're basically saying that they're full, that you got patients waiting in the ER for days, waiting to go upstairs, that your ICUs are full, so that when you have patients that aren't doing well on the floor who would normally transition into an ICU, even if you're in a big hospital, they can't go. They're having to be taking care of critical patients on the floor. And when you're at a small hospital like ours, patients that we would normally be able to transfer out to a higher level of care, we can't do it. It's gotten to the point where the full system is saturated, and that's what I mean by overwhelmed.
And that's something that we were hearing about. I remember back in March, somewhere in that timeline, as a member of the Georgia Municipal Association, we were briefed by a physician from Emory, an epidemiologist, and he was talking about this kind of scenario back then. And that's where we started talking about, I guess, flattening the curve and trying to keep the hospitals from being overwhelmed. But then we've been hearing that there's going to be this winter surge, and combine that with holidays where people are going to gather, and it's just kind of been a perfect storm, I guess, of circumstances to bring this about.
It's been an absolute perfect storm. And then the other, what worries me so much as a physician is when the hospitals are overwhelmed, you have patients that are dying of things that wouldn't ordinarily die because they can't get the care they need. So the COVID has so overwhelmed the hospital, and you got such sick patients that somebody comes in with congestive heart failure or cirrhosis exacerbation or just a regular pneumonia, that these patients who aren't as sick as the COVID patients aren't getting the care that they need because the resources are stretched so thin. And that's a nightmare scenario that we might be heading towards, and that's why we need to do everything we can right now to flatten that curve again, right. Try to take some stress off the system until enough people get vaccinated that we get to herd immunity and we can move this behind us.
Absolutely. Well said. It's very important that we get people vaccinated. You've made that point. We've got 2 good tested vaccines out there. I've been reading more on the Moderna vaccine because it's the one I understand that's available at our local health department. And I was reading that it's a 94.1% effective rate.
That's right.
At preventing COVID.
That's right.
And then the ones that did get COVID, the very few, I think there were 11 out of all of the ones tested
that
got the actual drug, none of them had to go to the hospital.
That's right.
So, and there are some side effects. So that's what I keep hearing. People say, well, I'm scared to get it because what if I get a side effect? I hear about Bell's palsy and different things. Tell us what your thoughts are about side effects related to the vaccine.
So the number one side effect is a sore arm. And I think we've all had, or most of us have had vaccines before, and a sore arm is something that we can put up with. The Bell's palsy thing, I think, is overblown, to tell you the truth. There were very few cases in the treatment arm, and there were very few cases in the placebo arm. And so there was no significant difference in the number of Bell palsy cases in the patients who actually got the vaccine in the trials.
And they matched the general population, what I understand.
They matched the general population.
If 4 people got it, 4 would have gotten it in the general population. So you can't say the vaccine
is the thing that caused it. That's right.
Exactly.
Some patients have reported a flu-like syndrome that lasts less than 24 hours. So that's a potential side effect, but that's not life-threatening, and COVID is.
Absolutely.
So that's where I feel the safety of the vaccine far outweighs any risk of the vaccine.
And you practice what you preach. You had the vaccine this past Monday, as I understand.
Had the vaccine on Monday, have a sore arm, but have otherwise done great.
Okay.
My partner and all my nurse practitioners have had the vaccine and have all done well as well.
Well, and I think that's what we need to stress is this is a life-threatening disease. Nothing could be more serious than a life-threatening disease. So, and the vaccine is very effective, minimal side effects. Now, if somebody wants the vaccine, let's talk about the process, because I understand there are stages.
That's right.
Or phases that we're going through. So somebody in the general public says, "Well, I'm ready for it." What do they need to do?
So that's a difficult thing at this point. Is we got to be a little bit more patient right now, because the vaccine supply is not where it needs to be, which it never is at the very beginning. And I'm sure they're running those factories 24/7 to get more out. But right now, the guidelines are that only frontline healthcare workers and nursing home residents are getting the vaccine. And so once they move through those and get the people vaccinated who choose to be vaccinated, which is hopefully everyone, then they'll open it up to patients that are 75 and older, because they're considered at high risk. They'll also open it up to what you consider essential personnel. That's a fairly broad category, but the best examples I've seen are teachers, because of their exposure to lots and lots of students.
Absolutely. Yeah.
Grocery store workers, because we need our grocery stores to stay open and running. There's some other ones that fit into that category as well. But once you get those frontline and essential workers done, then they're going to open it up, once the supply is adequate, to basically 65 and older with medical problems, and then it will move down to everybody in the general population. But this is where patience will be required, because that process is probably over the next couple of months.
Okay. And during that time, to reemphasize,
which is
social distancing.
Wear your mask, avoid large gatherings.
Wash your hands often, soap and water, hand sanitizer, high alcohol contents, 70% or better when you can't wash with soap and water, I guess. Isn't that the guidance?
That's right.
Okay. I try to reemphasize that as much as possible without being too in the minutia about it.
But these are what I call the easy things to do.
Right.
If we can just do those things, we can cut this back even before we get the vaccine, which is what I'm looking for.
And it's tough. I get it. We've all got COVID fatigue. We're tired of it. We're tired of not hugging our grandmothers and visiting our loved ones and doing those things.
But we don't want to lose our loved ones.
Absolutely. Yeah. The short-term sacrifice is
worth the long-term gain.
You said it better than I ever could have. Well, Dr. Goodwin, thank you for being on the program today. We've got about a minute and a half left. I guess the big thing is for people who want more guidance on what to do, Department of Public Health website, dph.org. I know there's a phone number on there. There's an 800 number. If you fit in that category 1A, if you're a healthcare worker, someone that's on the front lines, you can call that number and schedule an appointment.
That's right. They'll direct you to where you can get the vaccine.
Okay, so that's being done. Rather than us giving you the phone number now, direct you to the website, DPH, Department of Public Health, dph.org. Go to that website, or it may be dph.gov. Maybe dph.gov. Department of Public Health. Go to the website.
If you just Google Georgia Department of Public Health, they're going to send you to the correct website, and they're going to have great information on there about where you need to do, what you need to do, who you need to call, where you need to go.
Okay. Thank you so much for being my guest today. Anything you want to say in the closing few seconds?
I just want to reiterate what you said. Be safe. Let's take care of each other, but also take care of everyone else, because we're all in this together. And if we can get through these next few months, we can hopefully get back to what I hope to be normalcy for 2021.
Amen. I think we're all ready for that, and hopefully sooner rather than later. Let's just continue to do the right thing and push on towards the finish line and get the vaccine when it's available. Dr. Jeremy Goodwin, Chairman of the Board of Health, local physician, new school board member. Thank you for being on the first broadcast of 2021. Thank you for joining us today. Until next month, this is Eric Wilson, Mayor of Forsyth. Hope you have a great January.